Well, good morning, or is it afternoon? I do want to point out that I'm wearing exactly the same tie and suit that I was in that picture. You may wonder how innovative I'm going to be, but I'm actually going to challenge you to completely rethink what you think about health, and more importantly, the role that you play in changing health. So we're going to talk today about leading change in health, and particularly how we can improve our health status, particularly how you can improve our health status. And I'm going to use lessons from Appalachian, Tennessee, and America's poorest state. And by the end of my talk, you'll understand what that means. I'm going to, for the purpose of this talk, I'm going to talk about the health status of the eastern part of Tennessee, the 52 Appalachian counties of Tennessee, as they're listed here. But I can tell you that the issues we're talking about are true anywhere in the country. The health status of our nation is essentially the same everywhere. It's just a matter of degree. Okay? And for those of you that are from this region, you know why I choose to talk about it. It's our home. It's also the region that we know the best. East Tennessee is a region of incredible natural beauty and a deep and rich culture and heritage, but it's also a part of the country that suffers really significant health challenges. And that's what I want to talk to you about. What are the health challenges of our region, and how can we change them? Now, to understand the health challenges of any region, you have to have something to compare it to. And for purposes of our talk today, I'm going to compare the 52 counties of Appalachian, Tennessee with the rest of the United States. Okay? And typically in public health, when we talk about the health of a nation, the statistic that we use is life expectancy. It is the most basic, fundamental measure of health. If you think about it, everything that goes in to your health is reflected in life expectancy. How old is mom when she gets pregnant? Does mom use alcohol or nicotine or other addictive substances during pregnancy? Is that baby born in a safe environment? Does that child have clean water and abundant food? Can they get an education? Can they get a job? If they get ill or injured, can they get access to health care? All of that times 315 million is life expectancy in the United States. It's the most basic, fundamental measure of health. And all of you will be pleased to know that in 2014, life expectancy in the United States was about 79 and a half years, the longest it's ever been. And that's reassuring. Right? When my grandparents were born, life expectancy in the United States was about 45 years. So a huge change in life expectancy in the United States. Many people also assume that life expectancy in the United States is probably the longest in the world. But here people would be wrong. All right? In 2014, the United States did not have the longest life expectancy in the world. We weren't even in the top 10. We weren't even in the top 20. We weren't even in the top 30. In 2014, the United States ranked 33rd in the world, which you can almost see there, trailing behind 2.5 dozen other countries. 2.5 dozen countries that did better at this basic, fundamental measure of health than does our country. 2.5 dozen countries where a baby born today is projected to live a longer life than a baby born in the United States. To graphically show that, this is life expectancy for all the countries in the world, for men and women. Women are shown in red, men are shown in black. You can see the healthiest country in the world, women live between 85 and 90 years, and men live about 80 years. All the way down to the least healthy countries in the world where men and women live between 45 and 50 years, about where the U.S. was when my grandparents were born. There's the average country in the world, and here's where the U.S. ranks for women, U.S. ranks for men, and you can graphically see all of these countries that we trail behind. Okay? So that's a worrisome statistic, right? We're not the healthiest country in the world. But perhaps even more worrisome is that health is not evenly distributed around our country. This is premature death rate, early death rate, and I'll explain what the numbers mean, but you can see that it goes from Minnesota with the lowest early death rate, the healthiest state in the nation, all the way down to Mississippi with the highest early death rate, and there's Tennessee, ranked 43rd in the nation, the 8th least healthy state in the nation. So here we are in a state that ranks 43rd in the nation that ranks 33rd in the world. All right? But that doesn't tell us that much about the 52 counties of Appalachian, Tennessee, because we make up less than half the population of Tennessee. So we've developed a way of graphically demonstrating the health status of counties. And it goes something like this. We take all 3,141 counties in America, or however many they have data for, and we create a line that goes from the lowest county in the world, in the country, the healthiest county, all the way up to the least healthy. So we see counties with premature death rates below 4,000, all the way up to 15,000. There's the national average. Now don't worry about what the number means, but basically what it is called years of potential life lost before the age of 75. So if someone dies at 65, that's 10 years of potential life that they've lost. Okay? That's the United States average. There's the state of Tennessee, 18% higher. So our death rate as a state is about a fifth higher than the national average. Right? But what I really want to show you is where the 52 counties of Appalachian Tennessee show up on this map, on this chart. And there they are. 100% of our counties fall in the bottom half of the nation for this basic fundamental measure of health, early death. All right? And in fact, over 2/3 of our counties fall below the state of Tennessee. So here we are in a region where 2/3 of our counties are worse than the state that ranks 43rd in the nation that ranks 33rd in the world. Here we are in a part of the country that has health statistics that are worse than most other states and dozens of other countries. Think of all the things we cannot accomplish as a region because of the impact of this. Well, clearly, as community leaders, as members of this civil society, we want to change this. We want to change our health statistics. And the question is how? What can we do to fundamentally change these statistics? And this is not as simple a question as many of us would like to think, because our understanding of health has changed dramatically over time. So basically, for thousands of years, if someone died younger than someone else, the only explanation we had was fate. It was just bad luck. Maybe the gods were angry or the spirits had been offended or something. But for thousands of years, we really didn't have any explanation for why some people died younger than other people. Then, in the mid-1800s, they made a major discovery. They discovered that many people were dying from exposure to infectious diseases. Okay? Through unclean water, unsafe food, flies, mosquitoes, and so on. Probably around the time that this was discovered, 75%, 3/4 of Americans were dying from some sort of infectious disease. And that made a huge difference. It drove what we call the sanitation movement or the hygiene movement and fundamentally changed health in this country. And this was the pattern of what America basically thought of health at the beginning of the 20th century. And then around the time of the middle of the 20th century, we made another major understanding in how people die. And that was our behaviors. It seems so obvious now. We talk about smoking and obesity and lack of physical activity. But think about it. The Surgeon General's report on tobacco didn't come out until 1964. It really is a relatively new understanding that our behaviors drive our health statistics. Also, in the middle of the 20th century, we came to understand that fate isn't quite as random as it seems to be. That, in fact, it's driven, at least in part, by our genetics. Okay? This idea that some of us are born with a predisposition to better health than other people. The other change that happened in the 20th century was that medicine went from being an art to being a science. All right? And suddenly we discovered that access to health care also made a difference in people's lives. And this is pretty much the picture of health as we had it in America at the end of the 20th century. If we had had this conversation 20 or 30 years ago, I would have said, look, folks, what we need to do, we need to make sure everyone has access to health care, and we need to help people change their behaviors. And that is still completely true. But it's not truly complete, because we've come to understand a whole nother set of factors that distinguishes health from lack of health in our country. And these are the so-called social determinants of health. This very odd idea that my health isn't just driven by who I am genetically or my behaviors, but by the society in which I live, the things that go on around me. Now, as you look at that list, everything up there will make some sense to you. You will understand how those things impact health. But what you may not appreciate is how incredibly strongly they impact health. Now, I don't have time in the next hour and a half to go over all of these, but I'm just going to pick one of them, and that's the one that I think is most important for our region, and that is the issue of income, or better known as poverty. Okay? Just as with health, poverty is not evenly distributed in our country. If you look at all 50 states, for the percent of children living in poverty, you'll see huge disparities, from low numbers in the 10s to high numbers in the 30s. There's a state of Tennessee where over a quarter of our children live below the federal poverty line. Federal poverty line for a family of 4 is about $24,000. 1/4 of our children are starting their lives below that line. But of course, again, that doesn't show us Appalachian Tennessee. So here's all the counties in America, from counties with less than 10% of their kids in poverty to counties with almost 50%. There's the national average. And those are the counties of Appalachian Tennessee. 90% of our counties fall below the national level in terms of poverty. So you say, okay, well, so what? I mean, Dr. Wykoff, you're the Dean of Public Health. You're supposed to be talking to us about health. Why are you talking to us about poverty? And the answer is poverty is a tremendous predictor of poor health. We have a way of demonstrating that I think you'll find interesting. What we did, we took all 3,141 counties in America, and we arranged them not by where they are geographically, not by their names, but by their income level. Median household income for the last 5 years. Right? We arranged all 3,141 counties from the richest to the poorest. And then we said, what would happen if we divided America into 50 new states based on income? The richest 2%, 1/50th. The richest 2% would be the wealthiest state in America. The poorest 2% would be the poorest state in America. And then when we compare them, we'll be looking at nothing but income. All right? So the richest 63 county, you all knew 3,141 divided by 50 is 63. All right. So now I'm going to show you the poorest 63 counties in America. You'll see a cluster in central Appalachia. You'll see a cluster in the Mississippi Delta. You'll see southeast, a little bit around the U.S.-Mexico border. Tennessee has 3 counties in the bottom 63. Okay? So let's create a new state from those counties. Now let's show you the richest 63 counties in America. No, we won't. It would help if I press the right button. There we go. We don't see the geographic distribution as much as we see that it's associated more with big cities. All right, Boston, Philadelphia, New York, Washington, D.C., Atlanta, Nashville. Tennessee is one of the 5 states that has counties in the richest state and the poorest state in the nation, which suggests it isn't always about money as much as perhaps how it's circulated. Let's create now the richest state in America. Now, once you've done this, there's all sorts of ways you can compare these two. We don't have time to do a lot of it. I'm just going to show you one comparison. Okay? And that goes back to this. Remember, this is all the countries in the world. There's the national average. This is life expectancy, the most basic fundamental measure of health. Here's the richest state in America for women, the richest state in America for men, the poorest state in America for women, and the poorest state for men. 2 things. 1, in our richest counties, women live 7 years longer than they do in our poorest counties, and men live 10 years longer. Think about that. 10 years of life expectancy difference defined solely by income. But perhaps the more interesting finding on this chart is look where that white line is. That's the average country in the world. Half the countries in the world have a life expectancy that's longer than the people who live in the poorest 63 counties in our country. Half the countries in the world, people live longer than they do in the poorest counties in America. We essentially have a developing country in our nation defined by poverty. So what does this mean? What if we want to improve health in Appalachian, Tennessee, or in America's poorest state, or in the nation overall? There's three things we need to do, of course. We need to make sure that people have access to health care. And that's not a political statement. How you get there is up to everyone else. But health care is a value. We need to make sure we change people's behavior. But we also have to work together to reduce poverty. And what that means is jobs and education. And all of a sudden, all of us who've seen our careers being about improving health realize that we won't be successful if we don't work with the business leaders, if we don't work with the educators, if we don't actually get together and create the environment which allows people to get out of poverty. To put it into words, we have to work together to assure access to health care, especially preventive services. We need to work together to encourage healthier behaviors, and we need to work together to enhance economic opportunity and improve educational achievement. And what these all have in common, of course, is we need to work together. These are not problems that Washington, D.C., or Nashville, or Kingsport can solve on their own. These are not problems that Republicans or Democrats or Libertarians or Socialists can solve on their own. But especially these are not problems that business leaders, educators, healthcare providers, elected officials, faith leaders, or anyone else can solve on their own. They are only problems that we can solve together, and they can be solved together. If we work together, this will affect health in every part of the nation, every state, but perhaps nowhere more so than in our region of Appalachian, Tennessee. That's my great-grandfather. He was the city health officer in Charlottesville, Virginia, at the time of the sanitation movement. That's my son Kevin, studying health physics in South Carolina. My son Greg, who's in medical school. My daughter Kathleen, nursing school. My daughter Andrea, who hopes to become a veterinarian. That's my wife. That's me. I know you don't recognize me without the helmet. But I always close with this slide to remind me to say that nothing that I've talked about has anything to do with politics, nothing to do with statistics, almost nothing to do with public health. It's really only the question of whether we, as the leaders of this community, would take the kind of actions that we need to take to give our children a region that is as healthy as it is beautiful. Thank you very much for your time, and look forward to the rest of the day.
Thank you.